Welcome back to Sane. I'm Joe Carducci, and today we're cutting straight to the chase. There's a bill moving through the Senate right now that would gut healthcare for millions, slash benefits for working families, and hand out tax breaks to billionaires. If you've seen the headlines, you know exactly what I'm talking about. Trump and his minions call it the big, beautiful bill. I call it the Billionaire Boner Bill. Senator Patty Murray refers to it as garbage. And my guest today, Senator Tina Smith, simply and succinctly puts it, don't come for our health insurance. We're seeing billionaires and their allies claim this bill is about jobs and the future, but the reality is it's working families, children, and the most vulnerable who are paying the price. Senator Tina Smith of Minnesota has been on the front lines fighting for moms, babies, and working people, pushing back against billionaire giveaways paid for by defunding healthcare. If you follow her, you know she doesn't mince words when it comes to standing up for families and calling out the bullies, whether they're in the Senate or on billionaire yachts. I am very excited. I wish it were under better circumstances to welcome Minnesota Senator Tina Smith. Again, I wish these were happier circumstances because you are right now fighting against what the Republicans are calling the big, beautiful bill. I've seen you refer to it, and some of your colleagues as well, as a betrayal. I wrote about it being a betrayal today. Can you give us a little bit of a synopsis of why you're calling it a betrayal, why your colleague Patty Murray called it garbage, what is in it at the moment, where it stands, and what, most importantly, Americans can do to stop it?
Yeah. Well, first, thank you so much. And I am talking to you right now from my little office in the basement of the United States Capitol. And we have been here all day long. We're probably going to be here all night long. We're voting on, we're trying to make, the Democrats are trying to make amendments to this bill to make it not so terrible. We're hoping that we can stop it. I'm a realist. I'm always an optimist, but I'm a realist. All we need are 4 Republicans who would agree that they do not want to kick people off of Medicaid in order to pay for tax cuts for billionaires and large corporations, that they do not want to vote for a bill that is going to raise costs for regular Americans in order to give, the vast majority of the tax breaks in this bill to really, really wealthy people. And so that's the job that we have right now. And I don't know if we're going to be successful, but all we need are 4 Republicans to join with us. And frankly, as you said, join with Americans. Americans don't like this. This is not what they wanted. Whoever you voted for, you did not vote to make it harder for rural hospitals to stay open. You didn't vote to raise energy costs for families that are already struggling to pay their bills. You didn't vote to, make it harder for people with mental health care challenges to actually get their health care covered by insurance. And so that's really what this is about right now.
And I was just reading a statistic Sam Stein posted that nearly 48% of Americans haven't heard anything about this bill, and only 8% of all Americans name Medicaid cuts as a detail in the bill that they've even heard about. So this, when they do hear about it, it's overwhelmingly unpopular. Again, Senator Murray calling it garbage, but we need, I'm trying, right. to you sound the alarm for you. And I appreciate you so much for doing this, because that's what we need to be doing right now. So how can we get that other half and more people to understand what's in this bill?
Well, I'm really sympathetic with people who have busy and complicated lives. A lot of people are literally just trying to hold it together. And so they don't have a lot of time to think about what's happening here in Washington, D.C. But the thing that gives me hope is when they do tune into it, when we reach them. And that's why what you're doing is so important, that they are going like, hold the phone. That is not what I want to see happen. That is not how I think things ought to be done. And a lot of people are just there. People are not watching cable news that much anymore. They are, frankly, it's so stressful that I think they just kind of want to get away from it. And so finding ways for people to get good information in new creative ways, which is, I think, a lot of what you're doing, is just really important. And I'll just tell you honestly, like my Republican colleagues and Donald Trump, Republicans in the Senate, they basically want everyone to think that this is a done deal, that there's nothing that can be changed. They want people to just be exhausted and give up and just go home, go away. And so we can't let that happen. We still have a lot of power and we have to use our power. And let's just like into the nitty gritty of this. At some point over the next 24 hours, the United States Senate is going to vote on this bill, and it's either going to succeed or it's going to fail. If it succeeds, it's going to go back to the House, and the U.S. House of Representatives is then going to have to grapple with it again. And so there is still a lot of place and a lot of time for people to make their views known on this and say basically, hell no. Like, I don't want to cut people's health insurance or people's, nutrition, food stamps, just to pay for tax cuts for billionaires.
Yeah, and I think that part, and the shift in wealth from the bottom to the top, the
Right.
biggest, most precipitous shift we have ever really seen, I believe, in modern American history. I feel like those two things, when people hear them and they feel that injustice as they're struggling, to pay for groceries, to pay for gas. I'm a mom of two. I'm a single mom of two. My kids are 12 and 15. And always at the front of my mind is, how will this impact my kids, both in their immediate future, and what am I saddling them with for their long-term futures? And so I want to talk about the kids aspect of this, but also I was, and I'm uniquely positioned to ask this question because I was a paraprofessional for autistic preschoolers. I was one for 7 years. And so I've also seen, and it didn't pay a living wage, unfortunately. So I had to receive donations and groceries from my friends, etc. So I've seen two other sides of this that are going to be potentially impacted, which is the nutrition assistance that our children rely upon and the services that our autistic children need to succeed, to exist, to thrive. I was at the shadow hearing that Senator Murphy and Senator Kane held last week or 2 weeks ago. Thank you for participating in that. And little Landry was there, a little boy whose mother brought him because he is autistic. And she talked about what the impacts will be on him. So I want to just quickly, if we can talk about children, because I think that this is so nonpartisan that we can actually get people to care when you say our children are going to pay for this.
Yeah, I'm so excited to talk to you about this. And I wanted to maybe talk about it in two ways. The first is you think about like the parents of an autistic child. And first of all, like we say as a country, as a community, that we want every child to be able to live to the very best of their capacities. And we know that people, like everybody, needs support, needs a hand in order to be able to reach that best potential and that best capacity to have a happy and fulfilling life, whatever abilities or disabilities that they have. And so Medicaid is one of the most powerful tools that we have to help families of autistic kids make sure that their kids have the resources that they need. A lot of families might have private insurance, and then Medicaid comes in and it helps fill in ways that family might really need. A lot of schools access Medicaid in order to make sure that kids in schools get the support that they need. And then you talk for a minute about nutrition programs and food stamps. A lot of people have this idea that folks that get Medicaid or who rely on SNAPs are just not working. And actually the opposite is true. You know this from your work and your job. Like the vast majority, almost all of people who are on nutrition assistance, SNAP, including moms and dads with little kids, are working. Some of them are working more than one job. And they still are not making enough money to put food on the table, especially at the end of the month when their paycheck is run out. And like when you tell people that the average SNAP benefit is roughly $6 a day, I mean, try taking care of your family at $6 a day right now. And what are the Republicans doing? They're stripping away the improvements that we made to update the SNAP formula so that people could actually buy healthy food. That's what they're taking out in order to be able to pay for their big tax breaks. So that's one really big way, right? That this has an impact on families and kids.
And when you think about the fact that they are doing that so that their billionaire bros can buy another bidet. You know what I mean? It's like this, it is just spitting in the faces of everyday Americans, but of all Americans who aren't lucky enough to occupy a position where we don't have to worry about where that next meal is going to come from or where that next gas bill is going to come from. They don't, the fact that they could put on the altar of sacrifice those who need the help the most for those who don't need it at all just seems antithetical to who we are.
It's just wrong. And when you think about this bill, which is basically people in this country that are in the top 0.1% of income are going to be getting hundreds of thousands of dollars in tax breaks. And people like the paraprofessionals that we know and the childcare providers and the personal care attendants that are helping families, people who make $50,000 a year or less, their income is actually going to go down because of this bill. So it is, as you said, exactly right, Joe. It's like the largest wealth redistribution, like taking money away from regular people and putting it in the pockets of wealthy people that, we've seen in the last 100 years.
And I just want to ask two things in closing. Number one, you'll see someone like Carolyn Levitt go out today. I've heard this line a lot of times recently. Mike Johnson, I believe, even said this. Oh, no, we are improving Medicaid. These are improvements to Medicaid, reforms. These are not cuts. They're gaslighting the American people when they are paying attention into believing that this is actually rooting out waste, fraud, and abuse and making the system better. And by the way, to your point about SNAP, what I learned at your hearing the other day was that for these food banks that are already stretched and spread very thin, for every one meal they provide, SNAP has been providing 9. So again, that's another number that I find just absolutely shocking. But I want to talk about dispelling those lies. That's what the word is. The lies that Republicans are telling right now to give it a spoonful of medicine to this poison they're trying to shove down our throats. And the last part is, like to your earliest point. What can Americans do once they start really learning about what's in this and how it's going to hurt not just them, their neighbors, their friends, their colleagues, their coworkers, their children down the line? What can they do? So we'll just start with dispelling the lies and then giving the American people the voice to fight back.
Yeah. Okay. So on the first part, I listen to Republican senators upstairs and they say, oh, no, we are just trying to make sure that Medicaid goes to people that are worthy, that are who we wanted to help originally. And so basically they're trying to divide us into people who deserve help and people who don't deserve help. Well, it's just, it's an outrage. And basically their whole plan is to throw up all of this red tape and hassle so that people who are eligible for Medicaid, you can't even fight your way through the red tape and the bureaucracy, and you just give up. And then, of course, what happens is you don't go to the doctor, you skip an appointment, you don't have your medication, and you get sicker. And that's terrible for you and your family, and it's actually bad for our whole society. And so it is not true that they are improving Medicaid. If they wanted to improve Medicaid, they would have the basket of benefits would be better. They would make sure that all mental health care was provided for. They would say that if you're a physician that accepts Medicaid, that you're going to get reimbursed at a rate that is at least something close to the cost of the care that you provide so that you will be able to take patients. None of those things are happening here. They're basically just saying we're not going to pay for some people anymore, but they're not doing anything to help people be healthy or help cure them if they're ill or help cover the costs. So, and the last thing, and I so appreciate this because, as I said, I think there's this whole big effort by the conservatives and by the MAGA people and by Trump out there to have us think that there's nothing we can do, that this is out of our hands, that most people want to take Medicaid away from people, that most people are on Trump's side. And actually, that is just not the case. So I want people to know that their voices are really powerful, that the things that you can do, whatever feels right for you to do, whether it is to talk to your neighbors or make a phone call to a member of Congress and tell them how you feel about this. People in Congress pay attention to that. And your voice is very powerful.
Yeah, the power of the people is much stronger than the people in power. And as long as we still have a functioning democracy,
Right.
we cannot lose sight of that. And I'm so grateful, so appreciative for your fight, for your work, for your voice, for your tireless efforts towards, towards bettering this union for all of us. I mean, the contrast couldn't be any more stark in terms of what the priorities are between these two parties. One party, my party, your party, the Democratic Party puts the people first, and the Republicans put dollars first. They put the rich.
Follow the money. Just follow the money, and you will see where it leads. And so, yes, so thank you so much for doing this. I'm glad to have a chance to talk with you today. And I'm going to go upstairs and vote again, hopefully pretty soon, so we can keep on trying to do something and just have everybody remember, all we need is 2 more Republicans to say no. And
Senators Murkowski and Collins.
and we can stop this bad bill.
Yes, I have heard through the grapevine that maybe Senator Collins is leaning no. I don't know if that's true, but some little birdie said maybe that it is.
Yeah.
We just need 2. And that's where our voices come in so powerfully and so importantly. And that's why voices like yours are so imperative to this fight. Thank you so much, Senator Tina Smith. And go get them. Give them out.
Yeah, thank you. You too. Bye, everyone.
Bye. I want to thank Senator Smith for joining us today. For everyone listening, now is the time to make noise. Call your senators, share your story, and don't let them trade your health care for a billionaire's tax cut. If you found this episode helpful, please rate and review Sane-ish. Share it with your friends and follow us for more real talk and action. Stay strong, stay sane-ish, and keep fighting for each other.